Welcome to Caring for You. This podcast celebrates everyone who gives, receives, and needs care. I'm Patty Williams of Home Care Resources Now, and we're diving into stories, insights, and moments that remind us of why caring for others and ourselves still matters. Thanks for joining us. Welcome to Caring for You. This is a podcast where we talk about all things caregiving, healthcare. We are not limited to any area of healthcare or caregiving. And today I have with me the CEO of MedAssist, Miss Brenda Vass. I met Brenda a while back, maybe a year ago, and we didn't get to chat, but we were at a different event a couple of months ago, and I chatted with her about what she does. And I really wanted to share that with my audience. So Brenda, thank you so much for coming in today. I really appreciate it. And I would like for you to introduce yourself to our audience.
Patty, first of all, thank you so much for having me. My name is Brenda Vass. I'm the CEO of MedAssist, which is a statewide charitable pharmacy, the only one in North Carolina that covers every part of North Carolina. We are built on collaboration, and our goal is to ensure that no one has to choose between food or medicine.
That is great, and that is such a wonderful goal and such a great mission. What made you start an organization concentrating on that?
Well, the organization was started about 30 years ago. I had not even moved to Charlotte by then, but it was based in Charlotte, and it was to sort of fill the gap for seniors that did not have access to medication. At the time, 30 years ago, there was no Medicare Part D, and seniors were struggling to keep up with the medication they needed. And MedAssist was born out of that. And then once Medicare Part D came into effect, MedAssist started to support adults, just uninsured adults. And then we got a grant from Roy Cooper, who was at the time the Attorney General, for $2 million to go statewide, and we have been growing ever since.
That's great, because I know medications can really be a concern. When I was putting aides in the home, I had clients that couldn't afford their medications sometimes. And they were working that out in all kinds of ways, readjusting, skipping, doing all of those things. And then there's lots of over-the-counter medications that are very expensive. Just general things that you need in your home, a pain reducer or temp reducer, Tylenol or something like that. Those are things you need to have, but many people cannot afford those. So I know that you do some things in that area too. And so I just really love the work that you do. So what individuals do you feel are mostly impacted by not being able to afford their medications?
Well, Patty, I'm glad that you said that, because you're right. The least compliant person means that basically they're not keeping up with their medication. The only reason, or the main reason for that, is that they simply cannot afford it. And if they can't afford it, most likely those impacted by this are people who have low income, a lot of folks in the rural communities, brown and black communities, those that are historically in poverty due to systemic oppression historically. So typically those disparities are around healthcare as well as medication access.
I definitely see that it's a great mission. And since I met you, I've been trying to tell individuals about it. So if someone wanted to start to utilize your services, how would they apply?
We have several ways to apply. You can self-refer, which means that you can contact our office and you'll talk to a social worker and they'll get you everything you need. You can go to our website and apply right online, which is a lot easier for a lot of people, because you don't necessarily have to have access to a fax machine or a computer. You can use your phone to apply online. You also can go to some of the free clinics that are located all across the state. Those clinics typically are associated or know of us, And once you let them know that you can't afford your medication, they may refer you to us and then help you apply for it or give you an application from our organization. There's several different ways. If you are even interested in seeing if you are eligible, you should definitely view our website or call. We do have different languages that you can use on our website. Also, we have bilingual folks that work for us that can discuss it. But the eligibility is you have to be 300% of the federal poverty level. You have to be uninsured, which means that you have no access to prescription insurance. And then you have to be a resident of North Carolina, which means you have to live here in North Carolina.
Okay, so when you mention your office, do you have a physical office where someone can come to?
Yes, we actually do. Even though we're a statewide agency, we are located in Charlotte, North Carolina, right near the airport. But we are mail order when it comes to our prescriptions. It's called our free pharmacy program. It's mail order. Even if you lived across the street, we would mail it to you if you needed to. It kind of eliminates the transportation issues that we know plague a lot of folks. But also, you can walk in. It's built to walk in. But you mentioned over-the-counter medicine. We actually have a free over-the-counter store right on site in Charlotte. Anyone that lives in North Carolina can come to the store and get products like pain reliever, like cold medicine, allergy relief, children's medication, vitamins, all the things that you usually find in a drugstore, you can find at MedAssist free store right on site in Charlotte. You do not have to live in Charlotte. You do not have to live in Mecklenburg County. You can live anywhere in North Carolina. And if you get there, we'll be happy to serve you.
Well, I wanted you to know there was a event that you did where you set up as a vendor and you brought lots of over-the-counter medications. And one of my friends was there and she could not believe the things that you had available for them. So she went back to her senior community. She told them all about it. So I just feel like there's a lot of people that really don't know about your organization. And I'm going to put it on my website as a resource so that when individuals go there, they can find it. So do you collaborate with physicians and pharmacies?
Patty, I want to first thank you for just being an ambassador for our mission. We do know a lot of people go without medication simply because they do not know we exist. And that is heartbreaking. Literally, people are having to have a limb amputated because they didn't have insulin, or they are incurring costs in the emergency room because they can't manage their health on their own because they don't have access to their chronic medication. So being an ambassador by sharing that we exist is one of the ways that anyone can get involved and share the message. While we are located in Mecklenburg County, we are built in a collaborative model. Our organization works with everyone. Anyone that wants to seek out our program or refer people to our program can do so. We have some formalized partnerships across the state with a lot of free clinics and hospitals and things like that, but that does not require you or stop you from referring folks. We do need to educate our physicians more, but there's so many across the state. It's going to take folks like you to sharing the message. And also we'll be planning how we can work better with hospitals to let them know when they're releasing folks that are uninsured that they've already contacted us so that there's no gap in care and they can receive their medication in their mailbox by the time they get released from the hospital. So we are built to be collaborative. We enjoy working with so many folks. Specifically the safety net industry, they are always looking at what else that person needs so that they can stop them from falling in the cracks. So if there's ever an agency, if you're out there helping people and there ever is a conversation about medication, you should ask them, have they tried MedAssist? And even if they're not eligible, our hope is to share information with you that you would be eligible for, including individual patient assistant programs with that manufacturer directly or other pharmacy programs as well.
Well, you all really do a lot. So it sounds like you have quite a team to accomplish this. Can you tell us about your team?
Yes, I have a very, very passionate team. They are self-motivated and they are passionate about the mission itself, and including me, right? I've been with the organization for 10 years now, and 4 of that was in the CEO role. But before that, Chief Development Officer, where I help raise money and awareness across the state. The team, we have about 35 full-time employees, and considering we cover the state, that's a small group, right? We have 1 that lives out in Greenville, North Carolina, 2 in Asheville, and then the rest of us are in the Mecklenburg County area. Because we are such a small and mighty group, we rely on so many volunteers to get the word out, to execute on our mission, to share, to deliver a product. We rely on our volunteers to help us do that. We have thousands of volunteers all across the state and community partners. So it's important for us to not only maximize those opportunities and resources, but we know that they have the trust already in their local community that allows them to share that NC MedAssist is a free pharmacy. You don't have to pay anything, because a lot of people feel as if it's a gotcha, right? That nothing's free in life, right? But we are completely free, and we'd love to help more people. And so our team would use those volunteers to help get the word out as well.
That's great. I'm glad you mentioned the volunteers. So if someone's listening and they want to become a volunteer, what do they do?
They simply need to go to our website, and on their website, there are different options to volunteer. If you're in the Charlotte-Mecklenburg area and you're looking for something to do during the week, you can actually sign up to sort medication. Our over-the-counter program we have a warehouse that we get deliveries every week, and we need that medication sorted, and we also need orders to be prepared. So the volunteers come in during the week to help with that. We also have opportunities to volunteer all over the state, because we take that over-the-counter medicine and we deliver it across the state. You can find on our website a list of the events and locations that we'll be in, giving out over-the-counter medicine, and you can sign up as a volunteer for those events as well. And we are all across the state for those. So no matter where you're listening from in North Carolina, we probably are coming to an area near you. And if you're interested in volunteering, we'd love to have you.
Is there a screening process for a volunteer when they sign up?
The only screening process we have is that you have to be at least 12 years old, but if you're under 18, you have to have a supervisor with you. There are waivers that you need to sign that you would, make sure that you keep any information that you see confidential, or that you wear the appropriate clothing because you're in a warehouse or you're dealing with boxes. If you're working at one of the events, we want to keep you safe, and that you are willing to carry our values, I should say. It is important for us to treat people with dignity and respect, and we want our volunteers to extend that same courtesy to our volunteers, because when they're volunteering, they represent NC MedAssist. So if you're one that doesn't believe that people should have anything free, you're not one of the people that we want volunteering for us. We want people to experience the best customer service when they're seeking out assistance, and never feeling like they are less than when they come in contact with anyone representing our organization.
That is wonderful. Do you have a story that you can share with us about the impact of the services that you provided to someone?
Absolutely.
Please.
We always make a one patient video a year, right? Just share one patient story that will resonate with people across the state on why NC MedAssist is needed. When Medicaid expanded, we had some folks thinking that we wouldn't be needed and everybody would be taken care of, and that's not true. We're hundreds of thousands of people still uninsured and not eligible for Medicaid, so that's where we come in play. One of the families that I want to mention is not eligible for Medicaid is a young he's about my age, about 50 years old, and he has a family that he took care of, and then he had a stroke. And his family jumped right in and wanted to care for him, but realized the medication was $300, $400, $500, sometimes $1,000 that he had to have in order to care for himself. He also couldn't talk any longer. He can't walk on his own. He just needed full-time care. His family, his wife actually turned into the caregiver, right? But their children who were young decided to take on jobs. The teenager cut grass. The young lady who was just out of high school, she took 2 jobs, all because they had to pay for their medication. And they were so worried. And the young lady who told the story, his daughter, shared how he would cry because he saw his family struggling to try to care for him. And they ended up going to one of our partners for assistance, and they told them about us. And when I share with you the relief that they shared that they had once they found out that they could get his medication free, they didn't say that, oh, they're relieved from life's issues. They said it made it so much easier for them to then focus on other bills. And that is the issue that people face every day. They are choosing to pay one bill over the other, and medication tends to be the last thing that they choose, because they may decide that, oh, we have to eat today, so I'll choose food, or we have to have electricity, so I won't get my insulin. But we don't, our mission is that no one has to make that choice. So this family no longer has to make that choice. And I thought it was a really good thing that the daughter shared, that she just thought about the people that needed care, like her dad, but didn't have a family surrounding them, that went into like fix mode, right? And you think about all those people that don't have access to our medication because they simply don't know. And she said her dad was happier, he's more relieved. He still has to have 24 hours care, but his face on the video, very light and smiling with his family, seemed to be a totally different story when they were burdened with all of those bills. So I know that is one story, but that represents so many others that are going through the same thing and that maybe quietly going through it, but to know that we help thousands of people every year that are able to stay on our program for a year at a time. So if they need us past that year, they can keep us, which is awesome. And if they don't need us, they can tell us that they won't be using us, and it's perfectly fine.
Do you see any issues with individuals complying with their medication regimens? Do you see that on the end that you're working on?
Yes, we do see it, because I think that's a normal thing. But the thing that we noticed was those individuals that were least compliant had comprehension issues on how to use their medication or how to refill their medication. And a lot of times it was a language barrier, or it was just a comprehension barrier with literacy. So those folks we call and check up on them to ask them if they need to refill their medication, and just walk them through the system and why it's important for them to take their medication. But we have a pretty high compliance rate for our organization, but there are always some folks that just simply did not know how to refill because they had a language barrier or just not understanding how to do that. But we've been working hard to make sure those people are getting the help they need by reaching out to them directly.
So let's talk about a scenario. Someone gets a diagnosis and they get a prescription for a drug that they just can't afford. Mm-hmm. Where do they go from there? Say someone told them about you and they come to you. So what happens next?
So I think it's important to reiterate that we are a pharmacy. Okay. So when you see NC MedAssist and you don't know what it is, a lot of folks think that we just help you get medication, but we are actually dispensing. We have pharmacists on staff, we have pharm techs, and those folks are also available to chat with, like if you had a question about your medication, right? Mm-hmm. So if you're leaving with a prescription and you can't afford it, first you need to tell your doctor that you cannot afford it, or tell the front desk or nurse that you cannot afford it. When they're writing the prescription, they don't know that you can't afford it. They don't know that you can't access it. So if you share it with them, many of them will know that we exist, but some of them will also possibly give you another route to get it free of charge, right? But if they share that we exist, or if you just Googled free medication, we should come up, like free medication in North Carolina. We are the pharmacy. So you would have your doctor send your prescription to us, or you can send it directly to us yourself when you apply. And we will fill the prescription and send it to you in the mail. You will get a letter once you apply for it. You'll get a letter to say you're approved, and it'll tell you how long you're approved. And it's, like I said, 365 days for a year. And if you need us longer, we say you just have to just reapply, and we will get you in the system. But that's how you get started. You must say something. I know it's hard sometimes to say that you need something, but when you're in the in front of your physician or in your doctor's office, and they give you something that most likely you already know you can't afford, you can say something, and they will provide the resources that will allow you to get that medication free.
Yeah, the key point that you mentioned is, it's a drug you can't afford. Many times individuals don't find out that they can't afford it until they go to the pharmacy to pick it up, or they're at the drive-through window and they go, that'll be $828.
You're absolutely
and
right.
And that's when they discover it. So hopefully, they'll find out about you and come to you then.
Yeah, that is our hope. Our hope is that every pharmacy knows that we exist. Every hospital knows we exist. Every clinic, every resource agency that people go to find help knows, health departments. We're hoping that we could be the go-to for anyone that doesn't have insurance, and they'll understand that that's the pharmacy of choice, right? Because we don't have limits of where we'll go, because we cover the entire state of North Carolina. So if you can't afford your medication and you don't go without it, there's always another route, possibly that either is MedAssist if you're uninsured, or there is a way to apply directly with that manufacturer to appeal to get that medication free because of your income. And a lot of the pharmaceutical companies will absolutely send it to you, and you're good for a year for them as well.
Great. How can home care agencies help with your mission? That's my specialty. I'm in the home care area. I'm a home care consultant. And so I like to be sure I provide resources, but how can home care agencies be part of your mission?
Well, when I think about home care agencies, I think of what you're already doing as an ambassador. But I also would implore home care agencies to ensure that those caretakers that are living with them are also taking care of themselves.
Yes.
And oftentimes they're not able to work, which would most likely they'd be uninsured, and they may be putting their health in the back burner, basically, and not caring for themselves. So even checking in on those caregivers to ensure that they are taking care of themselves, and if they say they're uninsured, the question is next, have you heard of MedAssist, right? We also, when they contact us, refer them to other agencies. Like if they don't have a provider, we refer them to one of our partners that's close by to them. If they need food or anything like that, we can provide that. But your role, Patty, in your industry is critically important, because sometimes they can't even get out, the caregivers, right? They can't even get out of the house because they have to be there until the folks come to visit the person that they're their patients. They have a little bit of respite, right? But if they're able to at least go online on their phones and apply, their medication would be sent to them in the mail. So they don't have to necessarily go far to get their medication, just to the mailbox. That's it. So I would say, as a role of someone who is taking care of the most vulnerable in their homes, also look at those other folks that are living in there to ensure that they're taking care of themselves, specifically that caregiver. We do provide over-the-counter medicine, but because we're not mail order over-the-counter medicine, the other option is if we do have an over-the-counter event coming into their area, they can order it through homebound, which means that someone at the group that in that local community will deliver it to them, and we arrange that ahead of time from that local area.
Okay, so let me just understand this. You can mail a prescription medication to them, but not an over-the-counter.
Yes.
Okay.
Yes. If we had the funding, we would certainly mail the over-the-counter as well. But our goal right now is to ensure that everybody gets that chronic medication that they need, oftentimes daily. We also have behavioral health meds. I didn't mention that that's one of the things that we feel passionate about as well, because a lot of folks that are under the care of someone else, or they have to take daily medication, sometimes they are also experiencing mental health crisis as well. It could be depression, it could be something even like anxiety or bipolar disorder or things like that. We have medication. So if you're being seen by a physician or ER and they've prescribed you something that's behavioral health, that's also something that we can provide as well.
How do you measure the success of your program?
So for me, and I'm getting emotional thinking about that success, because success to me is someone not having to lose quality of life or their life at all because they simply could not afford medication. So every time we send out medication to any patient, that is success. They have not had to go without. They didn't have to. Their situation didn't worsen. They didn't, go to bed so worried that their parents didn't get access to medication. That to me is success. And yes, it's one at a time, but the stories that you hear, that keeps the humanity in. They're not numbers, they are people, right? And so that gets me emotional. I know that I'm doing something great. Our team understand the importance of what we're doing, and we feel like that success. We hit, touched 90,000 people last year. So to be able to answer a call and do it joyfully and provide that dignity and respect to individuals, to me, that is success.
Is there anything that has surprised you about individuals not being able to afford their medications? Anything that was very surprising that you didn't know prior to you getting into this mission?
And I will flip this a little bit. What surprises me most when you look at affordability for medication is that someone thinks that everybody can afford it. That surprises me. We often hear, it's only $4. But when you look at someone who has very limited income and they have to pay where they live and utilities and feed their family, the $4 is a choice between a loaf of bread and their medication. And often people choose food. That is why we do what we do every day, because the perception is that they're good. That is where they fall in the cracks, because the perception and the system thinks they're good, right? Yes. And we know they are not. There are thousands of people choosing every day to not get their $4 medication that could literally save them their lives, keep their blood pressure at bay, And so I think it always surprises me that there is this assumption that everybody's taken care of and anybody can access medicine because it's only $4 or whatever that amount is. So that's my surprise.
Yes, that's a great point. As far as individuals that are unhoused or homeless, do you do any special work with them, or do you have any stories about working with that population?
Yes, so we've worked with shelters for quite a few years now. The thing about folks that are in transition housing or they are not sheltered is that we know that their life can change a drop of a dime, right? They are one place and then they're another. And they could even be, I'm not talking about necessarily someone necessarily on the street. Like some people are homeless that are staying on couches, and there's nothing stable about that life, right? So for us, it was important to eliminate some barriers. When you fill out an application, we always ask you, where's your address, right? They don't have addresses. And for us, we were able to ask them, where would you feel comfortable sending the medication? And they go and they may ask a certain friend or a family member that they can't stay with, or a shelter, can we use this address, right? And for us, that's important to eliminate that barrier so they can still get it. And we do 90-day fills. So that means that you don't have to you don't have to expect your medication every month. You get your medication every 3 months, right? Because that way you don't have to, it's not a burden to contact us and get medication again. The hope is that we keep it in your presence and you don't have to call every 30 days to get refills. You can do that every 90 days. And if you don't, we call you, right? Asking you, do you still need that medication? So, being unhoused or not having a stable place to live will not hinder you from using our program at all. All we need is some place to send it. A lot of times we know that they use a clinic that has a pharmacy right in their neighborhood, and they may go over to that clinic as well to get their medication, and the pharmacist there will receive their medication and provide it to them and hand it over. We also have a partnership, just a pilot program that was started last year, helping people right on the street, and that's something we were invited to take part of in Charlotte. And it was a way to address, the unhoused that are literally living on the street and not take them out of their element necessarily, but treat them right on the street. And we were happy to sign on as the medication provider that gave them long-acting injectables to monitor and help them with their behavioral health disorder, and it allows them to stay at least at that stable space mentally for quite a while, because it's a long-acting injectable versus a pill they have to take, right? So those are some of the things that we are happy that we were brought to the table in some projects, and we're always open to hearing more of how we could assist those that are struggling to maintain stability because they simply don't have their medication. And this includes folks that are coming out of the judicial system, right? Yes. And so our hope is that we can catch them before they end up going back to jail or being hospitalized simply because they did not have their medication and could not stabilize mentally or physically.
Wow, that is a great program. So how long have you been involved in that pilot?
The pilot has been over a year right now, and we're finding, pilots are to find information out, right? Mm-hmm. So we had to pivot a little bit because we noticed that a lot of folks had Medicaid, so someone was doing their job, right, signing them up for Medicaid, but they couldn't afford the copay. So we've been able to help with the copay in that instance, and that's a pilot program. We don't typically do that, but again, our hope is that we can help relieve some of those barriers to people getting access to medicine.
And one of the key things is that you met them where they are.
Exactly.
So probably more of them tried to get access to their medications because you came to them. Now that probably is a program that you did in Charlotte where you're located, right? Mm-hmm. So that is not a program that you would do in other parts of the state, or?
The pilot program,
yes.
We as a mail order organization, we don't want to ever exclude any area of North Carolina because we're not headquartered there. We are mail order. One of the things we're good at is distributing medication. We can get medication to you. And so what we do is we work with partners. So if there are local partners probably providing the healthcare side for those folks, and then we can provide the medication. So it's not necessarily limited to our local office area. We're hopeful that folks think of us when they need medication.
That's great. So you would just need a partner in that local area.
Absolutely.
And then you could execute that. What can our listeners do today to make a difference and help you with your mission?
Well, first of all, if you want to help, have the right mindset, okay? Because there's so much need out there, and there's a perception that folks are getting something for nothing sometimes, and it has this very nasty taste to it, honestly, when we hear it. It's medication. We want people to have access to medication. And if there is anyone that doesn't have it, allow us to see if we can help them with it. So if you want to help, be an ambassador. Make sure you tell anyone and everyone that we exist. That is so helpful to us. Mm-hmm. And if you know someone works somewhere, they work and they have They don't make a large wage, but their company doesn't offer insurance. So if you know someone in that situation, they most likely don't have insurance. And we don't want to wait until people are sick. You can have a pharmacy home before you even need us. So you can already have been signed up. So just in case something happens, you already have us available. And I think that it's important for us to be that proactive too. So being ambassadors, not just for people who are already going without. And I absolutely say, do not hesitate to tell anyone that's going without insulin or anything to do with their heart, or those silent killers that are out there. Let's help our folks, right? Let's tell them that it exists and that the application actually isn't hard to fill out. It takes about 10 minutes to fill out, and then you can you can upload it online or take a picture of it and send it to us via email. We've eliminated all of those formalized barriers, because once the pandemic existed, we realized everybody had to pivot, right? We had to figure out how we got to people where they were, and yes, technology helped with that, because we knew most people had phones. So now you can use your phone to apply and take a picture of the application. You don't need to fax it in. You don't need to send it this formalized way. We just want to help. And if you have any questions about how you can get involved in other ways, you can go to our website, but you also can call our office and talk to someone about how you can help. If you're a pharmacist or a nurse, someone who's looking to use your medical background, we'd love to have medication consultants at our mobile events that we have across the state. We love to offer our participants that one-on-one consultation with our pharmacists and our nurses that are out there. They absolutely love the one-on-one attention, and they get to ask all these questions about medication before they select the medication that they want from us. Or they'll let you know that they are diabetic and they are curious about which cold medicine to take. So if you're wanting to get involved, there's probably something you can do, and we would love to have you. So visit our website and see what works best for you, your schedule and your abilities, and sign up there. If you like to donate, you can donate as well. We are always taking money. So we're always taking money, but we are good stewards of that. Any donation that you give us, and we're good stewards of your time as well. We know you're here to make a difference, and you will make a difference. So whether it's a gift of time, a gift of talent, or a gift of treasure, contact us. We will gladly use whatever talent, whatever treasure, and whatever time you're able to give.
If you could change one thing about medication access in this country, what would it be?
I would make sure that everyone had access no matter what. Because at the end of the day, there are some people we can't help, because we are bound by our pharmaceutical partners to make sure that folks are 300% of the federal poverty level, right? That's our eligibility. Mm-hmm. Now, that we could help a lot of people, but there are some people that eke out right at 301% of the federal poverty level that we couldn't help because we're bound, right? So if there was the world was different, I don't think we charge one, or we punish you because you can't afford it. And that's what it feels like. Your life is shortened if you can't care for yourself with the proper medication. And two, I do understand that medication, you have access to it, but the hope is that you don't need it forever, right? So it's whatever education you need as well is available to get you off the medication, right? But if you have to have the medication, at least have the access to it. So in my world, if there are no rules or stipulations, it would be that everyone had access, no matter the cost, and no matter where they lived, and no matter the socioeconomic background that they had or status, they would have access.
That's wonderful, and that's my hope as well. And you all are doing a great job with helping with that mission. Is there anything else that you would like to share with the audience today about the mission, what you're doing, future, just anything else that you'd like to leave with us?
Thank you. Thank you for listening. to Patty's podcast. It's doing amazing things as far as educating folks. Anytime you can learn, it's always helpful, and it may not make sense to you immediately, but when you talk to the next person, you realize that there's some information that you have that you can share. But also just being open, because I know right now is a very difficult time in the United States and all over the world, honestly, and it could be easily, you could put your head down and just worry about you. But I implore you, just to think about helping just one person. And that NC MedAssist keeps going because we know there's another person that needs us, right? So if we had volunteers and other professionals that are willing to help, we would love to have you. And so even though it gets a little hard mentally sometimes, never stop caring for another person. That is what we are built to do. And that joy that you feel doing it is selfish. I know it feels selfish, but the smile that they have on their face and the impression that they are seen and they are cared for, that is worth its weight in gold. So I would say never stop caring.
Well, I'd really like to thank you for coming today and sharing with us. And I know that there are going to be lots of people that will be enlightened by what you do, because had I not been at that vendor forum, I wouldn't have known about your services. And I was out there placing individuals in the home for 20 years. Wow. And had no idea. So I know that our home care constituents, I hope that you all will add this to your resource list, because we are running into people. I know we ran into them all the time that needed food. We sent them to food banks or whatever, and there's medications sometimes that they can't afford. So keep NC MedAssist in mind as an additional resource to help you to make your clients better. Can you tell us how to get in touch with the organization, your website, anything else you'd like to share?
Sure. Just visit www.medassist.org. That's MEDASSIST.org. It's open 24 hours. The website is, but we are open 8 o'clock to 4:30 weekdays. And we'd love for you to give us a call if you need to chat with someone or visit the website. A lot of information is right on the website that you can get in advance.
Thank you so much, Brenda. This has been Caring for You. Until next time. This has been Caring for You, presented by Home Care Resources Now, where care, conversation, and community meet. Thank you for listening. Until next time, take good care.